السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 5 in pediatric nursing. Today we are going to discuss 5 questions from question number 174 up to question number 178. معكم محمد اثنان يحيى. نبدأ مباشرة. Question number 174. The nurse is performing an assessment on a 10-year-old child suspected to have Hodgkin disease. Which assessment findings are specifically characteristic of this disease? The options are number A, abdominal pain and painless, firm and movable adenopathy in the cervical area. Number B, fever and malaise. Number C, anorexia and weight loss. Number D, painful enlarged inguinal lymph nodes. وقف الفيديو هنا واختار الخيار بتشوفه صحيح. The correct option is option number A, abdominal pain and painless, firm and movable adenopathy in the cervical area. اللي اخترنا الخيار رقم A نشوف rational. Hodgkin's disease is a malignancy of the lymph nodes. A specific clinical manifestation associated with Hodgkin's disease include painless, firm and movable adenopathy in the cervical and supraclavicular areas, and abdominal pain as a result of enlarged retroperitoneal nodes. So the correct option is option number A. Although fevers and malaise and anorexia and weight loss are associated with Hodgkin disease, but these manifestations are seen in many disorders. Question number 175. A school-age child with type 1 diabetes mellitus has a soccer practice, and the school nurse provides instructions regarding how to prevent hypoglycemia during practice. Which should the school nurse tell the child to do? The options are number A, eat twice the amount normally eaten at lunchtime. Number B, take half the amount of prescribed insulin on practice days. Number C, take the prescribed insulin at noontime rather than in the morning. Number D, eat a small box of raisin or drink a cup of orange juice before soccer practice. وقف الفيديو هنا واختار الخيار بتشوف صحيح. The correct option is option number D. Eat a small box of raisins or drink a cup of orange juice before soccer practice. اللي اخترنا الخيار رقم D نشوف rational. Hypoglycemia is a blood glucose level less than 70 mg per deciliter and result from too much insulin or not enough food or excessive activity. An extra snack of 15 to 30 grams of carbohydrate eaten before activity such as soccer practice will prevent hypoglycemia. And a small box of raisin or a cup of orange juice provides a 15 to 30 grams of carbohydrate. So the correct option is option number D. Eat a small box of raisins or drink a cup of orange juice before soccer practice. The child or parent should not be instructed to adjust the amount or time of insulin administration, and meal amount should not be doubled. Question number 176. The mother of a 6-year-old child who has type 1 diabetes mellitus calls a clinic nurse and tells the nurse that the child has been sick. The mother reports that she checked the child's urine and it was positive for ketone. The nurse should instruct the mother to take which action. The options are number A, hold the next dose of insulin. Number B, come to the clinic immediately. Number C, encourage the child to drink liquid. D, administer an additional dose of regular insulin. وقف الفيديو هنا واختار الخيار المشوسة. The correct option is option number C. Encourage the child to drink liquid. اللي اخترنا الخيار رقم C نشوف rational. When a diabetic child is sick, the mother should test for urinary ketones with each voiding. If ketones are present, the child should be encouraged to drink liquids because liquids are essential to aid in clearing the ketone. So the correct option is option number C. Bringing the child to the clinic immediately is unnecessary. Insulin dose should not be adjusted or changed. Question number 177. A healthcare provider prescribes an intravenous IV solution of 5% dextrose and half normal saline with 40 milliequivalent of potassium chloride for a child with hypotonic dehydration. The nurse performs which priority assessment before administering this IV prescription? The options are number A, obtain a weight. Number B, takes the temperature. Number C, takes the blood pressure. Number D, check the amount of urine output. وقف الفيديو هنا اختار الخيار المشوسة. The correct option is option number D. Check the amount of urine output. اللي اخترنا الخيار رقم D نشوف rational. In hypotonic dehydration, electrolyte loss exceeds water loss. And the priority assessment before administering potassium chloride intravenously will be to assess the status of the urine output. If the urine output is less than 1 to 2 milli per kg per hour, potassium chloride should not be administered. So the correct option is option number D. Option number A, B, and C are appropriate assessments for a child with dehydration, but are not related specifically to the IV potassium chloride. Question number 178. An adolescent client with type 1 diabetes mellitus is admitted to the emergency department for treatment of diabetic ketoacidosis. Which assessment finding should the nurse expect to note? The options are number A, sweating and tremors. Number B, hunger and hypertension. Number C, cold, calm skin and irritability. Number D, fruity praise odor and decreasing level of consciousness. وقف الفيديو هنا واختار الخيار المشوسة. The correct option is option number D, fruity breath and decreasing level of consciousness. اختار الخيار رقم D نشوف rational. Diabetic ketoacidosis is a complication of diabetes mellitus that develop when severe insulin deficiency occur, which lead to elevated blood glucose level. Recall that fruity breath odor and change in level of consciousness can occur during diabetic ketoacidosis. So the correct option is option number D. Eliminate option number B and A and C. Why? Because these signs are not occur with hyperglycemia. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.